today. He was born and raised in Southern California. He is a passionate person about movement, exercise, and living an active lifestyle. Omar graduated from Cal State Fullerton with a BS in kinesiology in 2014 and then finished his doctorate of physical therapy in 2017. He is currently an administrator at a skilled nursing facility at College Vista Post-Acute in Eagle Rock, where skilled rehab and nursing services are provided to patients recovering from different conditions in order to assist them with community reintegration. So Dr. Omar has spoken on different topics in the past, on ankles, on, I believe, on the back, about the back, neck. So we're going from head to toe, literally. So we're at the knees right now. So Dr. Omar, take it away. Thank you so much for being here.
Thank you for having me, and thank you for that introduction. It's nice to be back with you guys. I apologize. I think last time we were scheduled, I had some surveyors come to the facility. So periodically, we have people from public health, basically, just making sure that we're up to code with everything. I also recently had our annual recertification survey, and alhamdulillah, we passed and we did well. But that's like the big test every year for nursing homes. So because of that, to be perfectly honest, full transparency, I wasn't able to put in as much time as I normally do into my slides. But on the flip side of that, the knee is, I'd say, one of the more simpler discussions that we'll have. It's one of the more simpler areas that we're going to focus on. So I think we'll be able to kind of compensate for that. It's also one that I'm very, very familiar with because it's just such a common thing. So neck pain, low back pain, knee pain, I'd say those three are probably make up 60–70% of what I would see as a therapist. So right now, you guys can all hear me okay? Okay. I think what we're gonna do is I need to share my screen with you guys. Are you guys able to see that?
Yes.
Okay, very good. Let me just maximize it. There we go. Okay, so we're gonna start off with, it's a little bit hard to see this. Just some basic anatomy like we normally do. So this right here is a picture of your thigh. This is the front view. So this is as if you're looking at someone. Of course, the knee, if you can see my cursor, the knee is down over here. And what you have is on top over here. And these are, we're gonna stay very general because we can get very, very technical and very specific and learn every single muscle that, is around the knee joint. But honestly, I don't think it's, for the purposes of this talk, I don't think that's necessary. The main primary muscle of the knee and the thigh is the quadriceps. It's called the quadriceps because it makes up, there are 4 muscles that make it up. And these are the 4 different portions, but it's essentially one large muscle. And what it does is it starts up at the hip over here and it comes all the way down, crosses your femur, which is your thigh bone, and it even crosses your knee and into your shin. So if you touch your kneecap and you go below that a few inches onto your shin, that's where this muscle attaches, which makes this a very, very important muscle when it comes to your knee because it's essentially the primary, the largest, the strongest muscle that's going to cross over your knee joint. So quadriceps, that's the first one. On the back side over here, so this is us looking, I'm just turning down my office phone over here. I'm gonna take it off the hook actually. This is the back side. So this is as if I'm looking at the back of somebody's knee. And you have 2 main muscles over here, and your hamstrings are the first one. That's in the top. So similar to the quads, it starts all the way up at the hip and then runs down the back side of your leg, and it does cross the knee and attaches onto your shin. And then on the bottom side, you have your quadriceps. That's your calf muscle, which is one of the strongest muscles in your body, just because of the way the angle and the lever of the ankle works. These two muscles are also important to the knee, of course. After that, we're going to talk a little bit about the tendons and ligaments that are associated with our knee joints. So there's a lot of them, as you can tell. You know, we won't go into the details of what each of them do, but we'll just cover a couple of them. First, you have your quadriceps tendon. So just some basic definitions here. A tendon is something that attaches your muscle to a bone. A ligament attaches two bones together. So your tendon over here, your quadriceps tendon, attaches your quadriceps into your kneecap, and those fibers continue down into a ligament. And this is your patellar ligament, which attaches your patella or your kneecap into your shin bone over here. So you can almost think of your quadriceps as something that's starting all the way up at the hip, crossing the femur, attaching into the patella, and then continuing down into the shin bone. Then you have two ligaments on the side over here, the medial and lateral collateral ligament. Then you have some ligaments on the inside. And one area I want us to really focus on is your meniscus. So that's your cartilage. If you guys remember when we talked about the back, you have vertebrae that are on top of each other, right? And that's what makes up your vertebral column. In between each of those vertebrae, you have cartilage. And that cartilage is a shock absorber, essentially. And the knee joint functions much in the same way. So it's a very, very thick cartilage. And so when we run, jump, walk, that cartilage is supposed to do the job of absorbing that shock that's happening to your knee joint. So a takeaway point is, remember the meniscus, remember that you have ligaments surrounding your knee, and then remember the tendon that crosses over and becomes a ligament on the front side. And we'll come back to these things. So knee injuries and ailments. We're going to talk about three primary ones, because honestly, these are the three main ones that I've come across and that I'll see regularly. Number one on the list is osteoarthritis. Number two is just various types of ligamentous sprains. And number three is just general patellar pain, which can be related to the first two. Osteoarthritis. So we talked about that cartilaginous. Somebody say something? So the first one, we were talking about the meniscus, right? So it's that cartilaginous layer in between your knees. What happens is, as we age, and as we just have wear and tear from playing sports or just living life in general, this meniscus over here, this cartilage starts to thin out, just in the same way that the cartilage in your back might thin out. And what happens is you don't have that shock absorption. So now when you walk or you run or you jump or whatever happens, your knee bones are just grinding against each other. Or if they're not grinding, they just don't have as much absorption. Worst case scenario, this starts to cause bone spurring. So the bone starts to kind of chip, and then you have floating pieces of bone in your joint. Because keep in mind, these joints are covered not only in ligaments like in this picture, but there's also a joint capsule, and it's kind of tightly packaged right there. So now you got pieces of knee flying around in there. And then over here on the right side of the slide, you can kind of see on this image where my cursor is, how the knee is off center. This is a pretty extreme form of what happens when you have such fraying of the meniscus, or such thinning out of the meniscus, that the knee is no longer stable. So part of what the meniscus's job is, other than just shock absorption, is that it does help kind of keep the knee joint on track. So sort of how my knuckles right there make a groove, you can kind of see on the video, and my knuckles will fit into each other. If all of a sudden you flatten out the knuckles, the knee is just going to kind of move around. It doesn't have grooves for it to naturally fit in. On the right side over here, this is a healthier knee. You see a nice space in between. You see kind of black lining. That means that there's space between the knee. It's not grinding. It's more or less in a proper position. And then you can see over here, we're way off track. And of course, it's very painful because now you have all kind of nerves that are innervating the knee, and those nerves are now they're sending warning signals that, hey, this hurts, stop what you're doing. Ligamentous sprains. This one honestly tends to be more of an athletic injury, but it can happen to anyone really. You can fall and you have a sprain. This just shows the different levels of a sprain. A grade 1 would just be, some stretching of the ligament, some sort of irritation. Grade 2 is when you have a partial tear, and grade 3 is when it just snaps. And this is pretty severe right here. This requires reconstructive surgery and that sort of thing, depending on what your activity level is like. Suffice to say that on some level, every person will probably deal with a sprain, and like I said, on some level. And then lastly, we have the patella. So a lot of people will just get patellar pain, just generalized patellar pain around the kneecap. Sometimes it'll be behind it. A lot of times that's arthritic in nature. So just in the same way that the cartilage in between the knee joint right here, like in the first slide that we did right here, just in the same way that might be thinning out over here, you can have kind of the same thing over here. You can also have a lot of tightness. So this is where it's important, where I said that this muscle, the quadriceps, and this is a side view, by the way. So imagine you're looking at the knee sideways. This is the quadriceps coming down, and like we said, it attaches into the patella and then crosses down into the shin. Imagine if this bone or this muscle is very tight. Imagine it's super, super tight. So now what you have is a muscle that's pulling on the patella. Remember, the basic function of muscles is that they web together and they tighten up. So when you're exercising or you're flexing your arm, those muscle fibers are tightening up together. And it's pulling on this patella. You can imagine that could cause some irritation. Now, right here, what we'll talk about is some of the knee deficits that come as a result of these things, or these knee deficits happen as, these knee injuries will happen as a result of these deficits. This starts like an age-old argument of, is the chicken or the egg? Do I have these knee deficits because of these injuries, or do I have these injuries because of the deficits? And honestly, I don't know the answer. I think it's a case-by-case scenario. So these are the three most common deficits that people will see. Tight quads, weak quads, or weak glutes. Now, there's more to it than that. And when I say knee deficits, I'm talking about things that we kind of have in our control. So if your meniscus is thinning out, a lot of that is genetic. A lot of that is, lifestyle and just age and factors that we may not have total or full control over. These three are things that we do have control over to a larger extent. A lot of times what you'll see is, and this is especially common with women because women have wider hips than men, but what we call a knee valgus. And a knee valgus is when you have this internal bending of the knee. This is kind of an extreme form over here. Now, in this picture, you have a little bit of an angle, but it's much straighter than this one over here on the left, where you clearly have this extreme angle. This is a real person here, of course, and you can see how it's a woman, how her knee is coming in when her knee should be in line with her feet. So this knee, this center point over here, should really be closer to where the foot is. So this is a common thing that we see. A lot of times it's the result of having weak glutes or weak quads, and then injuries will follow after that. Now, interventions. What do we do about these things? Stretching is one, and I'll go over one of the stretches or a couple of the stretches that we can do. Another thing is traction. So you may have heard of traction in the context of your neck or back. Sometimes there's manual traction where a physician or a physical therapist will be pulling or mobilizing, so that way you can create some space in the knee joint. You can easily do that with the knee, where you just pull on it. So I would grab somebody by the ankles and I would pull back. And then strengthening. So to do this the right way, what I'm going to do is I'll pull up Google. Oops. So we can kind of go look at some pictures over here. We're going to go to our friend Google. Are you guys able to see my screen right now?
Yes. No,
Yeah.
actually, we see your PowerPoint, not Google.
Ah, you still see the PowerPoint. Okay, hold on, let me fix that.
I think you have to stop sharing and then reshare.
Right.
Talk about technology. I've done this many times.
I think the younger people have more knowledge than the older ones. So,
That's true.
yeah.
That's not always true.
No, it's not always, but most of the time.
No,
Technology,
you different type of
Technology,
technology. With
And then
technology,
you know how to be.
All right, here we go. So this right here is a Thomas stretch. And I especially like this one because a lot of times my patients have a hard time. I mean, if you're in pain, number one, it's harder to get into a certain position, right? Because you're limited with what your knee can do. So that's one. And then number two, just generally as we age, our range of motion generally decreases. And so this is a nice stretch that kind of everybody can do. So you would lay on your back, you hug one of your knees, and you let one knee dangle off the side of your bed or a treatment table like this. Now, in order to do this properly, you need a bed that's high enough. Sometimes people have lower beds and it makes it harder to do this, but you let this, this leg hang over. And if you see this picture right here, this gentleman's leg, the right leg that's hanging off the table, it's at an open angle over here. And what you want is you want to drive this foot back up this way. If you guys can see my cursor moving. In this image, he's doing it perfectly. Now, I would recommend hugging this knee because it kind of preserves your back a little bit more, but this isn't technically wrong. Now, what he's doing is, remember, the quadriceps starts over here in the hip, it crosses down, and it inserts over here, right? So by pulling your foot back, and he's just using like an exercise belt, but you can use a towel, you can use a regular belt, you can use anything you like, as long as it wraps around the foot and you're able to pull it back, and you will feel a very intense stretch right over here because he's elongating that muscle. Imagine your muscle is a rubber band. So it starts at the hip, rubber band travels, crosses the knee joint, inserts over here. If you're pulling this back, you're stretching that rubber band. If you relax this belt and the leg swings forward, you're now loosening that rubber band. That rubber band is on slack. So this is really helpful. This is really, really good, really nice stretch to address your quad tightness. And generally by solving that, you'll create some more breathing space in the knee. You can do a quad stretch in other ways. So over here, this is a face down one. And let me actually pull up a different picture that might be better. So face down like that, same thing, laying on the bed or the floor, anything like that, and you lay on your stomach, and you're essentially doing the same thing. You have a belt or towel, something wrapping around your foot, and you're pulling it, so that way you're getting knee bend. Now, the reason why I don't like this one, or I don't recommend it as much, is if you have back pain, generally laying on your stomach doesn't feel too great, depending on the nature of your back pain, but a lot of times it's not a comfortable position to get in. Also, the tendency is to arch the back a lot. So Actually, this is a perfect image for it right here. You can see this guy, while this looks impressive, he's getting a lot of back arching. He's lifting up his upper body. And when you lift up your upper body, it's the way the mechanics of the pelvis and the spine and how it all interacts. He's limiting the stretch that he's getting on his quads. And so this isn't as beneficial. And that's generally why I don't recommend it. Not to say that it's wrong, but I think you're better off laying on your back and letting the leg dangle and then using a belt to pull it. And this, I don't know what's happening here, but definitely don't do this. This is probably not a good idea. The third standing quad stretch over here. This is kind of your traditional one over here, where you're just standing and you pull the leg up like that. You can always use a chair, something to stabilize you. And this is a good one. There's nothing wrong with this one. Sometimes there's a tendency for people to arch their back as well, and you want to avoid that. You want to try to keep your back stable. I'll show you a picture of what it looks like when people arch their back. Actually, everybody's doing it pretty good here, so I don't see where they're going wrong. Okay. The last quad stretch is a sideline quad stretch. It's basically the same thing as the standing one, but you're just doing it laying on your side. Similar thing, the tendency, it's very easy to arch the back, and actually you can see it over here. If you see the waistline over here, how it's arching, that's what you want to avoid. You want to try to keep your back straight. And that's really why I like the one where you're laying down your back, because it's much harder for your body to arch it like that. Next thing we had was we were going to talk about traction. Knee joint traction. And this one, I would not have your husband or wife help you out with this. This is not a good idea for someone to do. You want a trained physical therapist to do this. I'm sorry, somebody said something? Okay. So you can see this physical therapist right here. What he's doing is he's grabbing onto the ankles and he's pulling on the knee joint, or he's pulling on the ankle, which is giving a little bit of breathing space in the knee joint. So we talked about arthritis, right? So you have grinding, right? When you pull on the ankle and you're pulling that knee joint apart, all of a sudden you create a little bit of breathing space, right? That feels good because now you don't have all that grinding. Now, this is a temporary fix, right? Your therapist might do this and you go, oh, you know what? That feels really great. And then when they stop, it goes back to normal, or maybe it lessens the pain a little bit. Now, what we want to do in coordination with this is to start strengthening the muscles around it. What happens is, here, I want to go back to, I'll just pull up a picture of the knee joint. Oops. So we talked about the meniscus. We talked about the ligaments. What happens is just naturally these things start to wear out, right? You're using them for a whole lifetime. You probably played sports, you climbed, you did whatever you did. They start to wear and tear. Now, the job of the meniscus and the job of the ligaments, like we said already, is to stabilize the knee, right? To stabilize it, to act as a shock absorber. What happens is when these things start to fray and to start to kind of wear out and lose their function, you need your muscles to kick in to do a lot more of the work. So they have to start stabilizing the body. So when you do traction, when your therapist is pulling on your leg and all of a sudden you feel a little bit less pain in that knee joint, that's all great, fine and dandy. But now you got to put in the work to stabilize the knee so it's maintaining that position. So I have a few exercises for you guys. I'm not going to throw too much at you guys because I think sometimes less is more. And one of them is called Clams, which makes it kind of easy to remember. So you lay on your side like this, and you bend your knees, a kind of 45-degree angle, somewhere around there, right? You keep your body rotated forward, so you don't want to be partially laying back. You want to be really on your side, and then you start opening up, lifting up your knee and bringing it back down. And you want to do this nice, slow, and controlled. Now, what you're going to feel is, or what you should feel is, right here in the back of the glute, you should start feeling like a muscle burning. And you might be wondering, what does glute strength have to do with your knee joint? A lot of times people's quads are fairly strong, but our glutes are weak. And when we walk, your quads and your glutes work together to stabilize the whole leg. If one part of that chain is off, in this case, your glute, now your knee joint and your quads are doing so much more extra work to keep you stable. And most people in, westernized, industrialized societies have very weak glutes because we sit so much, right? I drive through LA traffic from Orange County to LA every day. I spend 2.5 hours in a car. I have a desk job. I'm sitting down literally 90% of my day, right? And most of us are kind of in the same boat. And so our glutes naturally just start to weaken because you're not using them. You use your glutes when you jump, when you run, when you walk, and we're just not doing a whole lot of that. And when you don't do that, like I said, your quad and your knee ends up taking on so much more of the shock absorption that's where the issues happen. So this is an exercise that I do this exercise. I have my patients do this exercise. I think everybody should do it. Clams are one of the like, if I had to pick 10 exercises to do for the rest of my life, this would be one of them, clams. So this is a really good one. And you should, like I said, you should feel it if you can see my cursor in your glutes. So that's one. Next one is a long arc quad. So you basically sit down, and you can do this in the gym. They have a machine for this. And you basically let your leg dangle. I'm trying to see what do I want to use. This is probably a good one right here. So this lady's just sitting down, and she's lifting up her knee and trying to straighten it out. Now this exercise sometimes causes people pain. So if it causes you pain, don't do it. And in general, if an exercise causes you pain, stop doing it. It's not worth it. You're just aggravating what's already, causing you issues. And you'll see people do this at the gym, and they'll have weights on, around their ankle, and they'll lift up their leg up and down. And again, slow and controlled. And you want that quad to feel some tightness there. So yeah, this is a good one. You can also tie a band around you. So let's say with band. There's different ways to tie it. Over here in this example, he has it tied to the back of the chair, and he's just lifting up and down. If you have a therapist, this lady right here, it's tied all the way to the back. So there's different ways to have it tied off. Sometimes you can have somebody hold the band, and then you elevate, and you're working against resistance. Right here, you can really see it. He's got it tied up against the table. And then we got what's called a straight leg raise. This is a really nice one too right here. So what you want is, let's see. Let's use this one. So you lay on your back. Oh, this one's moving too. And you want to straighten out your knee joint. So this leg over here. A lot of people will do this with a bent knee. So they'll, like this lady right here, they'll lift up the leg and the leg is bent. You don't want that. That's not achieving the outcomes of this exercise. You want that knee straightened out. You want to tighten up your quads. You want to keep it as straight as humanly possible. And then you want to lift however high you can go. This is a nice angle right here, about 45 degrees. Beyond that, I don't think it's really needed. And you just go up and down like that. The most important thing though, is to keep that knee absolutely locked, totally straight. Let me see if I can find a picture where the knee is starting to bend, like right here, and they're pointing at it, you don't want this knee bend because now you're not doing the job of the quad. The job of the quadriceps is to lock out or to straighten out the knee. And if you're doing it with a knee that's bent, you're not really engaging your quads the way you absolutely can be. So you don't want to do this. You want to be more like, let's see. You want to be more like this, where the knee is totally straight. And it's easier said than done, because what's going to happen is as you get up higher, your knee is going to want to start to bend because now your quads are doing a lot of work. And then when you're on your way down, it's the same thing. The natural instinct is that you want to bend the knee a little bit. You have to resist that. So this is a really good one as well. The last one we'll go over before we get to some questions is a squat. This one you want to do it. It's, squats are weight bearing. And so you want to do it when you feel ready and you don't have knee pain. Because if you have knee pain, or if you have any pain and you're doing an exercise, it's not doing you any favors. Let's see. This is a good one right here. You can see this gentleman over here. He's sitting back into a chair, and that's generally the way we want to squat. You'll see people squat all kinds of ways. You'll see their bodies come all the way forward. You'll see their knees will be way over their toes. We don't want any of that. What we want is your rear end kind of reaching back for a chair. Sometimes, if you want to really get the form down, is just grab a chair, put the chair right behind you and sit down into it and stand up until you get the form down. So you're reaching back into the chair, then you come back up and down like that. You want to be careful, like we showed in that one image, not to have the knee caving in. So if you have your knees caving in and you're doing these squats up and down, you're likely causing more issues or more harm than good. You want your knees straight. That's why it's good to do it in front of a mirror or to have somebody watch you. And the nice thing about this exercise, you'll get glute strength, you'll get the weight bearing component, you'll get quad strength. It's kind of, you get a little bit of everything. And it's a functional exercise. It's something that, we're doing on a day-to-day basis. This is nice form over here. The knees are in line with the feet. So this knee joint, you have a little bit of angling in, but that's not, in the grand scheme of things, that's not too bad right there. One thing you can do also that I find to be very helpful is a lot of people will struggle with keeping their knees in. So you put a band around your knees. Now what that band is going to do, it's going to try to bring your knees in. And so you naturally have to fight against that and push your knees out. So those are the three exercises that come to mind, or four exercises, I should say. I know typically you guys have a lot of questions, and so I'm more than happy to answer them. I'm just going to go ahead and stop sharing. I'm going to share the screen again. Let's see. We can go back to the PowerPoint just in case. Okay. Does anybody have questions?
Yes, I have a question. How do you tell the difference between osteoarthritis and rheumatoid arthritis?
Ooh, that's a good question. That might be a better question for a doctor, a physician. To be honest, the pathophysiology of it, I'm not too well versed on. Symptomatically, or the way it presents, I know I can recognize sometimes the difference. So for example, with rheumatoid arthritis, I know there's like flare-ups that goes up and down, as opposed to arthritis, which is a little more consistent. But I think that's maybe better asked of a physician. In terms of treatment, the way we approach it, not a whole lot of difference. I've had patients that respond differently with cold and hot, with heat versus ice therapy, with rheumatoid versus osteoarthritis. But beyond that, it's a lot of the same principles. And honestly, in general, when it comes to rehab, you're using the same principles over and over. You're strengthening something that's weak, you're loosening something that's tight, and you're just doing that based on what's clinically manifested.
Yeah, I'm asking because I have started to feel little pain in my knee. You know, in the first video, the first slide you showed, that Vastus Medialis, that area, I feel it is not constant pain, but it kind of comes and goes. So that's why I kind of wanted to know if it is the osteoarthritis or because I have a family history of arthritis. So it's possible that, the wear and tear has started, but I just kind of want to know what kind of,
So the Vastus Medialis, so even if you look at this picture over here, this side over here, this is the medial side. So this is the inside of your knee.
Inside of that's where, yes, yeah.
Right. And this is more common. I mean, this is, we don't typically see it. I mean, it does happen on the lateral aspect, but we see it a lot more medially. And so it's incredibly common. And so the general approach is you want to keep your knee muscles, your quadriceps loose, because again, if it's tightening up, remember, you're bringing that knee joint together and you're just reinforcing that contact. So you want to keep that knee, your quadriceps loose. You want to keep your glutes strong and your quad strong as well. And one thing I'll say about muscle strength, it's not always about, strength is sometimes a little bit of a misnomer. It's not always about how strong someone is, how much you can lift. It's how well coordinated are you, how well you're able to activate that muscle when you need it. You don't need these big, strong quads. What you need is a quad that's going to turn on when you need it to turn on. So that way it's stabilizing your knee. So you're not getting, that grinding. In all likelihood, it's probably osteoarthritis. In all likelihood. Have you had any kind of imaging done?
Oh, that was a long time ago, not recently.
Okay.
Then, and I don't have.
The meniscus is fraying a little bit.
Yeah, I don't have any internal bending or anything. I mean, range of motion is good. It's just there is like slight pain, and sometimes it becomes a little more. It's not that it's unbearable or anything, but it is. I'm getting the pain. Thank you.
You're welcome.
I have a question.
Yes.
From time to Salam alaikum. From time to time, I can feel like my knee wants to give way. So I have started, instead of taking one step after the other to go upstairs, I take a step and bring both feet together and then another step, because I don't want to chance that it might go out. Any recommendations of what I might do to strengthen it?
Yeah, which if you don't mind me asking, which knee is it that feels unstable?
Oh, that's a good question. I'm gonna say the left knee, I think.
Okay. So if it's the left knee, so for safety purposes, going up and down stairs or a curb or anything, the common saying is, good guys go to heaven, bad guys go to hell. So you want to step with your good leg going up, and you want to step with your quote unquote bad leg going down. So if it's your left knee that's that doesn't feel as stable, you want to lead with your right knee going upstairs. And then when you're going downstairs, you want to lead with your left leg. And that's just from a safety perspective. And I would encourage you to do it that way until it feels strong, because it's just not worth, forcing. Some people will say that force the issue, you want to use that leg, but where are we going to find ourselves if God forbid something does happen and you fall, and we don't want that to happen. Now, as far as how to strengthen it, it depends on what's happening with the pathophysiology. If you're feeling unstable, it could be that some of your ligaments are sprained. Do you have any pain associated with the instability?
Not often.
Okay.
No.
And
not
when you do
often.
have the pain, where do you find it?
But I don't know because I don't have it that often. I think I feel it more when I'm tired.
Okay. And that
When
makes a
I'm
lot of
tired,
sense.
I try to really be careful if I'm tired.
Right. And then that makes complete sense because, and that's what I would expect, because again, your meniscus, your ligaments, they're doing the job of stabilizing that joint, right? Then your muscles come in and they add reinforcement to that. If your ligaments and your meniscus are not doing their job, you need your muscles to pitch in a little more, work or do a little more extra work, a little more stabilizing. So that way that knee stays firm on the ground. If you're tired, your muscles are tired, it's not going to stabilize that knee. And so therefore you're going to get more instability and then you get some pain. Now, without knowing the details of what's unstable and where that pain is and things like that, in general, I would still say you want strong quads and strong glutes. And so the clams that, the first exercise I showed where you lay on your side and you lift up your knee, especially on the left side, but I would do both. The straight leg raise, and especially because there's some instability in standing, I would start off with exercises where you're off your feet, where you're laying down on your back and you make that knee really straight and then you lift it up and then down. So that's called the straight leg raise. You could do the long arc quad where you're sitting down, you're letting your leg dangle and then you kick it out so that it's lifted up into a 90-degree angle. So basically the stretch of the exercises that I showed you guys in the pictures, I'd be curious to know if your quads are tight. Most people tend to have tight quads, and so doing that Thomas stretch or that quad stretch would be beneficial. But I would stay away from weight-bearing exercises for now until you can really tease out what are my limits, because the last thing you want is to be standing and get aggressive with some of these exercises and then you feel your knee buckle. That would be my general advice. I would either go see a physical therapist, and it sounds like the issue isn't too drastic, but you could see one and he'll give you a sense, or she'll give you a sense of where you're at, what your tolerance, and a little more specifics on exercises, or even just a highly skilled personal trainer if the situation isn't that bad. They might be able to give you some kind of tease out some things, but I think it's worth paying a visit to a PT.
Thank you.
You're welcome.
One question.
Yes.
When you're exercising, does it help to wear a brace, like a knee brace, as a preventive, so that you don't injure yourself?
Yes and no. Generally, physical therapists will, as a general rule, we try to discourage it because you don't want to become dependent on it. The bottom line is we want stability in the knee, and we would rather our muscles do that, stabilize us. Now, is it needed at times? Yes, but I would try to avoid making it a permanent type of thing. So there have been times where I've had knee injuries and I need to wear it, temporarily in my rehab process. But like I said, we don't want it to be a permanent thing. Are there some people where it's just their knees are so degenerated that they have to wear it all the time? Yeah, and I've come across certain scenarios like that where it's like they don't want to do surgery to have their knee replaced, and so to get through the day or to get through the activities they want to do, the knee brace might be the only option. But I would try to get your muscles to stabilize. I wouldn't automatically go to the knee brace.
Thank you.
You're welcome.
Dr. Omar, any suggestions when you know, I have had this happen with my mom, for example, like, you know, she's on the loop, like wondering whether she should go for surgery or not, like, you know, get a second opinion,
Right.
there, or, you know, getting a shot, a steroid shot or something to just reduce the pain temporarily. In that kind of scenario, what is your advice as a physical therapist? Like, you know, to be cautious, to avoid surgery as much as possible and do therapy. Anything on your end that you recommend for patients?
Yeah, I mean, ultimately, it's I would seek out a physician's opinion on it, but definitely, you know, people ask. My take on it is, and maybe I think some people wouldn't agree. If something's not working, I would change it out. So if it was, you know, I already know one day I'm going to need a knee replacement because I have terrible knees. You know, when I get to that point where I can't do what I need to do, I'll get a knee replacement. Now, some therapists will say, no, you should try to maximize what you have without it. And yeah, I generally believe that, but I wouldn't let it get to a point where my function is being impaired or limited. You know, nowadays, these knee replacement surgeries, they're very painful. I will tell you that. And the rehab is very painful because what I'm doing to people when they have a knee replacement is I'm forcing that knee to bend, because when you come out of surgery, you only have like 20 degrees of knee flexion, which is like just that. Your knee is bending barely. And then here comes, you know, big bad Omar, and I got to crank on that thing to make sure it moves. So it's very painful. But I think my personal take on it is, if your doctor's telling you that you're a candidate, and if your function is being disrupted such that you cannot do the things that you like to do within a reasonable expectation that you have of yourself, I would do it. You know, like if I'm walking, let's just say however many years from now, one of the activities I like to do is to go for a 30-minute walk. If it reduces to 25 minutes, I'm not going to get my knee surgery. But if I'm down to 15 minutes, 10-minute walks, and that's all I can do, but I want to maintain a 30-minute walk, personally, I would get it done.
Thank you so much. Great advice. Any other?
Yeah, no, I'll add one thing, because here's the other thing is, the longer you wait, the more, remember, so the worse that knee gets, the less activity you're going to do, which means the weaker all those muscles are going to get, which means after you finally get the surgery, if you ever decide to get it, now you're starting at a point where you're very deconditioned, and it just, in my opinion, it makes it that much harder. So a lot of what orthopedic surgeons do nowadays is they have people do like 6 weeks of therapy before they get their surgery done. And as a general rule, I would always go to therapy first before going a surgical route. So if I can avoid surgery, I would. But I'm just saying, if I get to a point where that's my only option, I personally, I'm going for it. Other surgeries may be a different story, but as far as a knee replacement, that's my take.
Question, can I ask you?
Yes, please, sir.
You come here?
Yes, just be loud.
That over my knees, I can't bend my knees to the full, like I can't square. I manage my life like that. I don't sit down to pray. I have to sit on a chair to pray. But it has been going on like this for a long time. Do I need, should I have gone for physiotherapy to improve my range of, motion of my?
Yeah, I think, so commonly speaking, generally speaking, I should say, when I see people who have limited knee flexion, that's knee bend, and they don't have their full range of motion, generally, a lot of times it's their meniscus. So that cartilage in the middle between the knee joint, there's like a tear in there, or it's fraying, it's thinning out. And so your knee kind of locks, or it's not able, because remember, one of the functions is it's not just a shock absorber, it's also a track. It keeps the knee on a path. So that way it's not going all over the place. And when that's limited, or it's not doing, it's not doing its job, you're going to have decreased range of motion. Now, what I would absolutely go to a physical therapist and see what you guys can accomplish together. But ultimately, it's going to come down to a lot of quad stretching. So like that Thomas stretch where you lay on your back or you're standing and pulling your leg up as much as you can. That knee traction where you're pulling and you get a little bit of separation in the knee. I'm a big believer in that. And then re-strengthening your muscles so that, or re-coordinating them so that they're comfortable working in a full range of motion. Because let's say you've been at 90 degrees, as an example, of knee flexion for the last year. From 90 to 120, so those 30 degrees or 40, 50 degrees, whatever you're lacking, your muscles are not operating in that range anymore. And you want them to, because that's how you're going to have the greater, the greatest level of functional mobility. And then generally, one other thing I would say is, a lot of times we don't address these things until they become major issues. I think it's wise to maybe take a look at it before it becomes, and maybe it never does, and inshallah that it never becomes a major issue. But generally, the human body just, we're all going to a certain destination. So, and our bodies are not perfect. Generally, these things are kind of fraying over time. And so I would address it before, the range of motion reduces more.
Thank you so much.
Thank you so
You're
much, Dr. Omar. Any questions?
One question.
One last question before we end.
Just wondering, does weight plays a big role in how you really issue at a young age?
Does weight play a big role? Was that the question?
Yes.
Oh yeah. Oh my gosh, yes, definitely. Thank you for saying that. I should have said that in the beginning. Weight plays a role in everything, honestly. Your knee, your hip, your back, your neck, the whole body. Even you see in professional athletes that as they get older, and when we say older, obviously we're talking relatively speaking, take a professional athlete at 25 years old and 35 years old. As they get older, they generally slim down because, it's harder to be as explosive and do all the same things. So it's the same thing for us. Like we're not professional athletes, right? But we're doing things on a daily basis. It's much easier to do it with 10 pounds less on you as opposed to having those 10 pounds. And obviously, the more, it makes it that much harder. So definitely weight is a big one.
Thank you.
Mm-hmm.
All right. Thank you so much, Dr. Omar. I appreciate again your time on your working day. We appreciate everyone here saying bye-bye and thank you to you.
Thank you so much.
So appreciate that.
Thank you. Thank you.
And Sister Rahana, Sister Rabia, Sister Hakika, thank you so much for attending online. I appreciate that. Everyone saying their salams, and have a great rest of the day.
Thank you all as well. Salama
Thank
alaikum.
you. Assalamu alaikum. Take care.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.